Good afternoon and welcome to PMMC's session today, Finding the Right Balance with Payer Variances, a retrospective look for insights from managed care and revenue cycle leaders. We are very excited today about the insight that our panel will be covering today related to key concepts, activities, staffing, communication that they're using to ensure complete and accurate reimbursement through a retrospective recovery review that really focuses in on those complex, tough denials and contractual underpayments. Today's discussion will really focus on several key concepts: having an efficient and effective process, having an efficient and effective staffing ratios to really work the challenging underpayment requests and denial appeals, and having the expected outcomes. So when I say an effective process, today we will be discussing and covering items such as regularly reviewing insurance policies and guidelines to avoid retroactive denials. We're going to be touching on identifying the reasons for denials, such as eligibility issues, coding errors, or data entry errors, how to use technology to automate pre-authorization, eligibility verification, and just your general workflow process. And we're going to address the resolution approach to those disputes, especially around timely filing and reimbursement issues. And really all of these involving all departments and the denial management strategy that you have in place. As it relates to the effective staffing ratios, we're going to be touching on with our panel, really covering the evaluation process around prioritizing your workflow, really starting from the initial cash collection process all the way through to your appeal specialist, and then any type of layering in of your outsourced vendors to really complement your internal staff, streamlining operations, which should allow your internal team to work the majority of variances, but also really utilizing an outside vendor that specializes in the recovery of these complex, slow variances, such as contractual underpayments and certain key denials, and really then optimizing that billing process so that that whole variance resolution approach is documented. So you've got a systematic process with all of these things. And then most importantly, we're going to have our panel share some thoughts as it relates to key monitoring steps for the desired outcome. Today, industry average denials range from 5 to 10%, but obviously keeping your denial rate below 5% should definitely be your target. And so we're going to be touching on the benefits of having the right balance to improve financial outcomes, reduce the financial administrative burden with doing it all in-house so that you've got an efficient and enhanced revenue cycle process going forward. Get to our panel of experts. We encourage you to submit any questions through the chat you'll find in the Zoom tool today during our session. And we'll have a member of PMMC's team available to answer any questions that you may have. My name is Greg Kay. I'm Senior Vice President of Revenue Strategy at PMMC. I've been with the organization coming up on 29 years, and I've really helped focus the organization around improving healthcare providers' financial performance through accurate reimbursement calculations. So before I really kind of move over to our industry panel, let's start with a quick poll question. So to start today's session with our first poll question, that question is, what is your biggest challenge to finding the right balance with your underpayment and denial recovery process? And we've got 5 responses. The first is having a solid process, staying current on payer policy changes. Second is having a solid process with variance root cause analysis. Next is having the ability to properly prioritize all variances for optimal recovery results. Fourth is having enough staff to adequately work all variances to fruition. And lastly, we have the right balance in place at our organization. Thanks everyone for your response and great feedback to really kick off today's session. Now let's meet our team for today's session. With me first is Cheyenne Williams.
Thanks, Greg. I'm Cheyenne Williams, Manager of Recovery Services. I've been with PMMC for about 5 years now, and I'm responsible for ensuring our team has all of the knowledge and the resources needed to quickly and efficiently identify underpaid or denied variances, as well as communicating those findings back to the client.
Thanks, Cheyenne. And also with us today is Greg Wagman. Greg, tell us a little bit about yourself and how you've seen the revenue cycle change over the past few years.
I'm Greg Wagman. I'm the Director of Managed Care and Decision Support here at Marshall Health Network. We're a 3-hospital system here and primarily based out of Huntington, West Virginia. I've been with Cabell Huntington, which is one of our facilities, for over 20 years, and really in this role of managed care for about 15 or so. It's changed a lot over the years. I've seen a drastic increase in the amount of resources that it requires, both from a people standpoint and a technology software standpoint.
Thanks, Greg. And also with us today is Jerry Rivet.
Hi, I'm Jerry Rivet. I'm a reimbursement and revenue cycle manager at Covenant Healthcare. I've been in the industry over 30 years, and the one thing that I've seen evolve over time is that there is much more attention put toward payment integrity reviews and also more complex reimbursement methodologies.
We really do appreciate you guys sharing your time and, more importantly, your expertise with us today. So to kick off today's discussion, let's talk some about some of the challenges that you have to navigate to really find that right balance, if you will. So Jerry, we'll start with you. What have you encountered as it relates to payer denial behavior and staffing issues with managing variance claims?
Regarding claim denials, we have just seen an increase overall. More claims being reviewed, more claims being denied. And so with that comes more resources needed to resolve the denials. And at times that causes staffing issues. So with turnover, it takes a little longer to get through the denials and also train up staffing. Now Covenant's approach is to focus on the process and to be as streamlined and efficient as possible to get through denials. But at the end of the day, at times we have more denials than we can get through. So now I know we use PMMC to help with these denials. Every organization may use an organization a little differently like this, but there comes a time where there are some denials that our staff just can't get through. So that's where PMMC plays in.
That's insightful and a great way to start off today's discussion. Greg, what challenges that you've encountered with payer denial behavior and staffing issues, what challenges are your team facing these days?
You know, I think a big part of this is just the increase in the complexity of the denials, and you can definitely see the automation and technical advances that the payers have made. You know, they're operating at a more complex level. So, you know, denial rates have increased. You know, various different reasons for denials have. It seems like every year you're kind of running across something new in the industry that's creating a whole new set of challenges for you as far as working denials. And on top of that, just like you mentioned, the staff required to work these accounts and to get them right on the front end, you know, through the authorization process, and then also working all of these issues on the back end once you get that initial denial. So it's not just a lack of staff. Well, it's a lack of staffing, and it's also a training issue with trying to keep these folks trained and bringing new staff on board and getting them up to speed. So it's definitely increased as far as the complexity of the revenue cycle.
Going off of that, Greg, what role does clear communication play between your team and external partners?
That's an important piece of it. Using your external vendors and having good relationships with them is important. There's a lot of our external vendors are key to providing creative solutions that help us in the revenue cycle, and we can't be so dependent on staff anymore. So we have to have some dependence on external vendors, and we need to be comfortable with them. There needs to be a trust level with them as well. So that's a very important relationship. So we're a PMMC client, and we're very happy to have those with you all.
That's a great reminder, Greg, especially, as it relates to smoothing out those staffing transitions at Cabell, and having solid communications is a real important piece. Jerry, anything that you would add as it relates to communication and your experience there with the Covenant team?
Sure. When it comes to payers, sometimes the payers use subcontractors, and that is an agreement between the payer and the subcontractor, but the payer may not always see the performance of that subcontractor. And we do see delays, and we do see difficulties in getting maybe an audit reviewed and processed. And so that is an area that at times we do need some help with, because our staff works through it, and then some of these accounts fall off the back end. So that is an area we've noticed, is sometimes those subcontractors the payers are using are not super efficient.
Agree, Jerry. Communication barriers can be a real challenge. So with your working with PMMC and other vendors, what does effective communication between your internal team and PMMC, those external partners, in handling these payer challenges, whether it's those clinical denial changes or the high dollar accounts? What does that look like in terms of handling the payer challenges with your team?
Our team, I think what the biggest benefit is when there is clear communication between both sides, where each internally we know what our role is and what accounts we are responsible for, but then we also know at what point in time are those accounts now handed off, and there's clear communication back and forth, so everybody knows, one, where that account is, and then two, what is required to get it resolved. Because sometimes the resolution is on the hospital side, sometimes the resolution is on PMMC side.
Yeah, that's a great point, Jerry. Utilizing external partners in the right way can truly play a huge role in helping out your internal team members. Cheyenne, shifting over to you, could you speak to how your team works with clients to just ensure consistent communication when, as both Jerry and Greg noted, there is an ever-changing payer relationship, updates that take place? How does that communication process look?
Of course, Greg. So our software really allows us to zero in on specific payer trends. So we leverage AI and analytics, and we can build tailored reports and compare all of these trends that we're finding across all clients. We like to keep constant communication with our clients to share what we're finding and assist with limiting some of those issues on the front end. So each client will receive a monthly report through BI that showcases the trends we've identified and the success rates we've had in each area. They also have access to our collector notes so they can see what we've collected on and really where we have success in those areas. Additionally, we also set up a monthly call with the clients to walk through those reports, as well as go over any other updates to ensure we are always on the same page.
Completely agree. Always being on the same page is an ongoing effort, and it sounds like there's a lot of ways you guys work, both in terms of verbal communication as well as those other support pieces, whether it's monthly calls, documentation, reporting, etc. Really kind of helps ensure everybody's on the same page. So let's shift gears a little bit. We've been talking about communication. Let's touch on some of the other issues when it comes to really finding the right balance. And a big one that's always on everybody's mind, and one that seems to be getting squeezed into a shorter and shorter time frame, and that's timely filing, which is always a topic of concern. Greg, since you're in managed care, how do you handle timely filing and the negotiation process?
It's definitely, you know, one of our key terms that that we're looking at when we get a contract proposal. And, you know, those terms have been harder to negotiate year over year as far as getting those within an acceptable window that gives us a fair opportunity to get claims out in a reasonable time and timely. So we've definitely seen challenges there, you know, where you might have previously been able to regularly get 365 days. In a lot of cases, you know, now you're pushing 180 kind of as a standard, and a lot of times you're even kind of looking at less than that, or at least starting from a negotiating point a lot less than 180. The other thing we see is sometimes it's even difficult to tell exactly what our timely filing is because, you know, some of these self-insured ERISA plans, you know, they have the employers have flexibility to have different rules than what you might have with the TPA. So, you know, once that claim is dropped, or you know, once that date of service happens, you really have a window that's ticking, and it may not be as long as you think it is. So it's important that, you know, these issues get worked promptly and quickly. You know, every day that goes by, you're just at a higher risk of that claim running into something that's going to ultimately prevent it from not being paid.
That's the catch-22 with timely filing limits getting shorter and shorter. It used to be very common, like you say, Greg, those were 1-year terms. Now it's 180 days is definitely becoming more the standard that we're seeing. Jerry, is your team having similar experience with timely filing and payers pushing to reduce that appeal window?
Timely filing was an area that we were having issues with, and a lot of times it is because the payer is stopping that claim for some sort of review, and the payer is not communicating back and pushing the accounts through. So I will say that these are some of the accounts that PMMC is working for us and have been successful in getting the payer to resolve it so it does not go to timely filing. And so that part has helped. And then another area is regarding timely filing is sometimes as these accounts are being worked, there's additional information that's required and maybe a rebilling needs to go out. And so when that happens, if we get that information timely and get it rebilled timely, that is another area we've been able to get our timely filing. You know, we're improving timely filing.
Thanks, Jerry. That's a good point. With an influx of denial and underpayment trends that I'm sure we're all seeing, and different timely filing deadlines across all sorts of different payers, it can definitely be difficult to make sure that each issue is addressed in such a short time frame. One issue that my team is seeing a lot of that can have a huge impact on those strict deadlines are DRG and ER downgrades, which I know we all dread to see those coming. Jerry, are you encountering any downgrades as an issue, and how does your team go about handling this?
Yes, we do experience downgrades. The DRG downgrades we handle internally. We have a team that works those, and it might be an area that probably could use some more attention. but the emergency level downgrades we do experience. Many payers are doing downgrades, typically using the Optum ED Analyzer tool as the basis, which is different than the resources that the facility is using in the ED. And those areas are a challenge because they're high volume, and so it's difficult to put enough resources on those to appeal them.
Jerry, thanks for that. I think that's important with kind of what you're seeing in Michigan and some of the key players, payers there. Greg, what role do you find downgrades playing with your team?
This is something that we're seeing more and more of, and it's an issue that you guys have helped us quite a bit with. The software, pretty easily identifies these when they can be difficult to identify. A lot of times they're small dollar amounts. They're not remitted back with denial codes. There may not be letters that come back that tell you that the particular account was downgraded. So you really have to kind of hunt for these and find them. And you guys have had a good amount of success in helping us recover a significant amount of dollars as far as it relates to the downgrade. So we certainly see that the payers are using technology, artificial intelligence, things like that to really increase the number of these, and we expect those to continue.
We do see a ton of downgrades. It seems like payers are super quick to downgrade the level of care on ER visits. And in most cases, it's such a small dollar amount that it can go unnoticed if it's not identified in bulk. Not to mention the number of resources it takes to appeal all of those downgrades with sufficient documentation so that the payers will overturn. Another thing similar to downgrades that our team sees a lot of are COB denials. So Greg, what has been your experience in handling these, and do they fall off the radar, or are you incorporating them in your day-to-day workflow?
I mean, there are various things that we try to do on COB. There are things we try to do at registration up front to, try to avoid those if we can, but that's not always the case. And we do have, several of these that still happen. And a lot of times, those accounts might get moved to self-pay if there's no resolution of the COB, which typically really involves some type of action by the patient. So a lot of times those might get moved to self-pay, and then the patient might get involved and complete their COB with their employer or with their insurer. So there could be a series of letters and things that would go out to the patient to try to get them involved, but it can be a very tedious process to get that done.
I know I would definitely be motivated as a patient getting a bill in the mail or a letter from some sort of health visit is the last thing that I would want. Jerry, what is your team seeing with these COB denials?
We are seeing a high level of high dollar coordination of benefit denials, the information being requested. And, our team internally typically work the higher dollar inpatient claims. So then when there is COB related issues on lower dollar claims, it is more difficult to get to those.
Jerry, you referenced high dollar claims. How does your team allocate resources to just ensure you're hitting both low dollar accounts as well as those high dollar accounts, whether they be COB denials or really any kind of variance, low dollar versus high dollar?
The higher dollar accounts we address internally, and then as needed, then we have PMMC then work the ones that we just can't get to.
Greg, how about your team? How do you guys allocate resources to ensure you're hitting that right balance between high dollar accounts and low dollar accounts but both have variances? Well,
I'd probably say we're not doing a great job on the small dollar ones. Those are definitely slipping through the cracks. You definitely prioritize the high dollar ones first, and then a lot of times you will when you do find those smaller issues, then the key is to really get into the data and extrapolate that and see, okay, how many claims have I had with this exact same issue over the past year or past 2 years, and really go back and see how material that amount is over the course of a long period of time. And using your all software certainly helps us do that. And we've had issues like that in the past where we have found, things as low as, $30, $40, $50, but they happen, thousands of times over the course of a year. And a lot of times you are able to go back to the payer and correct, a code that might be loaded incorrectly in their system, or for whatever reason, it's not pricing correctly. But overall, we probably could do a better job on the small ones.
Thank you for sharing, Greg. I definitely see how high dollar claims look like they definitely have more return, so they're easier to get to first. With strict timely filing deadlines and different payer behaviors, like we've already touched on, it can definitely be difficult to ensure that there's enough time in the day to prioritize high dollar claims and still hit the low dollar stuff as well. As a safety net, our team works behind the client following different rules of engagement. We make sure that there's no overlap or duplicated effort, but we also want to be sure that we're hitting all variances so nothing slips through the cracks. So coming behind you guys and working some of those low dollar stuff that you didn't get to in time, from prioritizing high dollar accounts, which I know are definitely important. After those rules of engagement have been met, PMMC's best practice is to stay on top of the payers, following up on accounts every 14 to 21 days. Payers definitely lose track of things, so we don't want to miss out if we wait to follow up with them because they said to allow a certain amount of time. So our research tells us that allowing a shorter time frame between each follow-up really helps us to stay on top of them and push things along.
I think that's a key point, Cheyenne, as it relates to just staying on top of things, because it fits with the earlier discussion around timely filing. So we had more leeway when timely filing was 365 days. Now that it's half that time with many payer contracts, you really do need to be on top of that from a touch standpoint, which leads us to our next poll question, which is, what is the average number of payer communications? What we're referring to here is touches. Do you find today that works for your organization before the payers actually acknowledge and reprocess a variance issue, whether that be an underpayment or a hard denial? And the options here are, on average, 1 to 2 touches, and touches again being call, submission, appeal, emails, etc. On average, 4 to 6 touches, 8 to 10 touches, or more than 10. And we'll give everyone another couple of minutes to input their selection. Terrific. And as I mentioned earlier, we'll provide the follow-up to the poll questions in the follow-up material. So do appreciate everyone's input there. And this really kind of tees up the next discussion topic, and that is the rules of engagement. And as far as the rules of engagement with your retrospective vendor, how important, Greg, are the rules of engagement for your organization when it comes to really that finding the right balance, if you will?
The rules of engagement are really key to the whole relationship, and also, having flexibility in those rules. I know with you all, we've had situations where we've gone through computer conversions, and our rules of engagement might look different for the period while we're going through a conversion with legacy AR and things like that, where you guys are stepping in a more active role. And then, the ability to kind of go back and reevaluate after that and switch back to something, I think is key. So having flexibility with those rules really helps. And then I think it's really a comfort thing with like CFOs and at the VP level that, we're providing a huge amount of staff to work these claims. And we just want to make sure that, we're not, that the fees that are paid are well spent, and that we're not kind of overlapping a lot with our existing staff.
Yeah, that makes perfect sense, Greg, because as we touched on earlier with communication, there needs to be great communication, not only with the payers in terms of follow up with the number of touches, but also that communication that often get defined, what we're calling here the rules of engagement of when do you want the vendor to pick up those variance accounts so that you don't step on the client's activity. But in the same respect with timely filing getting shorter and shorter, you don't want to wait too long because then the variances just don't get collected. So Jerry, along those lines, how important are the rules of engagement when it comes to finding that right balance for your organization?
I think it's very important on the rules of engagement. And there is a lot of activity from your internal teams as far as getting claims processed, and then also internal processes for resolution of denials or maybe audits and that sort of thing. So when it gets to the point of handing off to a subcontractor to, to pick up the ones that you haven't been able to be resolved, it's very important to have those clear lines defined both internally and externally for the project to work efficiently.
Awesome information today, everyone. Greg, Jerry, Cheyenne, a huge thank you for you guys making the time to share your insight with us and everyone that's on the call today. It's clear that managing contractual underpayments and denials is a real balancing act. And while challenging, there's definitely significant opportunities for improvement when approached with the right tools, the right strategy, the right collaborative efforts, so that finding that right balance is key to ensuring success with your team. Greg, from your end, any closing thoughts that you would like to share that we hadn't touched on, or any points you'd want to reiterate to everyone that's on the call today?
I mean, the only thing I'll add is just as a long-term client of PMMC, that you guys have helped us a lot over the years with these issues we've talked about today, and the staff has always been very helpful, and we're on calls every week to go over issues and review things. So we really appreciate everything you guys have done to help us, and look forward to sort of what our relationship continues to evolve.
Thanks, Greg. And Jerry, any closing thoughts?
I just think when it comes to this area, it is just very important to have good communication, training on the specific areas, and then and just make sure that all that information makes it to resolution, because I think that's all we're trying to do is get the claims paid for the fine services that the facilities have been providing.
Thank you, Jerry. We do appreciate everyone joining. And Cheyenne, from your end, any internal thoughts that you would want to share?
I'd just like to thank everyone for joining us today, and a special thank you to Greg and Jerry for your time. It's definitely been a pleasure.
Absolutely. Thank you. Thanks, Cheyenne. And again, as Cheyenne noted, thanks for attending today's session. This is the second of two series that we put together around underpayment recovery and addressing those issues. Feel free to go out to our website. You can find the link for the prior session as well as this session on our website at pmmconline.com to learn more and watch not only these sessions, but other sessions. We hope you have a great rest of the day, and look forward to seeing you at our next webinar session. Have a great day.